All right, Medicare changes for 2025. Big topic, I know.
It is.
But, whether you're getting close to that Medicare age yourself, or maybe helping a family member,
Yeah.
or just, trying to understand this whole system,
Right.
we're here to break it all down for you.
Absolutely.
We're going to deep dive today using this great resource from the Medicare Advisor.
That's a good one.
Yeah, it's really helpful. It breaks down all those key changes,
Mm-hmm.
things like premiums and deductibles,
Yeah.
and all those parts of Medicare, A, B, D.
All the letters, right?
All those letters.
It can be confusing.
It can be. And, I'll just say right off the bat, some of these changes are good surprises, and some of them not so good.
That's right. And let's start with one that might sting a little bit.
Okay.
The Part B premium. It's going up to $185 a month in 2025.
Ouch.
Yeah, a bit of an increase.
Yeah, this is a pretty noticeable jump. So does everybody kind of get hit with that same increase? Or does it, depend on your income?
It does get a little complicated there.
Okay.
Higher earners, so those who made, say, $170,000 or more in 2023,
Okay.
they're going to see an even bigger increase in those Part B premiums.
Okay, so it's kind of tied to what you were making back in 2023.
That's right, based on your 2023 income.
Got it. So what happens if somebody's, income has changed since then?
Yeah.
Say they retired this year, so their income's way lower.
Yeah.
Are they stuck paying that higher premium based on, their old income?
Well, not necessarily. There's actually an appeal process.
Okay.
If your income has dropped significantly because of certain life events, like, retiring or getting divorced or losing your job,
Right.
you can appeal and potentially pay a lower premium.
Okay, that's good to know. So it's not necessarily set in stone.
Right. Make sure you have documentation, though.
Yeah, paperwork, always fun. All right, so we keep talking about Part B. Part B, can we just maybe take a step back for a sec? Just remind everybody, what does traditional Medicare actually cover?
Of course. Traditional Medicare, that includes Part A and Part B.
Right.
It's designed to cover those hospital and medical services that are considered medically necessary.
Okay.
So think of Part A as your hospital coverage,
Mm-hmm.
and Part B is more for your doctor's visits and other medical services.
Got it. But so even with Medicare, you're telling me there are still out-of-pocket costs?
I'm afraid so. There are still things you'll have to pay for, like deductibles, co-payments, co-insurance.
Okay.
And those can change from year to year.
Oh, great.
For example, in 2025, that Part A deductible for an inpatient hospital stay, that's going up to $1,676 per benefit period.
$1,676 just to, walk in the door.
Essentially, yes.
Yeah.
And if you have a longer hospital stay, things can get really expensive.
Okay. So what happens after you hit that initial $1,676 deductible? What if you need surgery and there are complications? You end up staying in the hospital way longer than you expected.
Yeah, that can happen. So after the first 60 days, you have to start paying a daily coinsurance amount. It's $419 for days 61 through 90.
Oh, wow.
And after day 90, it jumps even higher.
So a long hospital stay can really drain your bank account.
It definitely can. It's something to keep in mind.
Yeah. And that's on top of that Part B deductible we talked about.
Exactly. Part B has its own deductible of $257 in 2025.
Oh, right.
And then on top of that, you're also responsible for 20% of the cost of covered services.
Even after you meet the deductible.
Even after you meet that deductible.
Okay, so we've got premiums, deductibles, co-insurance.
A lot to think about.
My head is spinning a little bit.
Yeah.
Can we talk about Part D?
Oh, yes.
That mysterious world of prescription drug coverage.
Part D, it can be confusing.
It can.
But there is one big change happening in 2025 that's really good news for a lot of people.
Okay, tell me more.
There's going to be a $2,000 out-of-pocket spending limit on covered medications.
That sounds like a win. Finally, there's a limit on how much I have to spend on my prescriptions.
It is a win, but there's a catch. This limit only applies to medications that are on your specific Part D plan's list of covered drugs.
Oh, okay.
It's called a formulary.
A formulary.
So if a drug isn't covered by your plan, this limit doesn't really help you.
Right, so if you need a really expensive medication, it's even more important to make sure that your plan actually covers it.
Absolutely. And don't forget about the Part D deductible. It's going up to $590 in 2025.
Oh, right. Another deductible.
I know. But the good news is many generic drugs might be covered before you hit that deductible.
Okay.
But if you're on higher cost brand name drugs, you'll likely need to pay that $590 before that $2,000 limit kicks in.
So lots of moving parts. Any tips for choosing a Part D plan? with all this going on?
Definitely use the Medicare.gov website. They have a great search tool where you put in your zip code, your preferred pharmacies, all your medications, and it shows you all the available plans in your area. And it ranks them by their estimated yearly out-of-pocket costs.
Oh, that's super helpful. So you can kind of see, okay, this plan is going to cost me this much. This plan is going to cost me this much.
Exactly. You can find a plan that really works for you and your budget.
Okay, great tip. So we've got Part A, Part B, Part D, all that fun stuff. What about Medigap?
Medigap.
I hear that term thrown around a lot, but I'm not really sure how it all fits together.
Medigap plans, or Medicare Supplement Plans as they're also called, they're designed to work alongside traditional Medicare.
Okay.
They help cover those deductibles and coinsurance amounts we've been talking about.
Oh, so it's like extra protection.
Exactly. Think of it as an extra layer of protection. And a big plus with Medigap is that there are no networks.
Oh, okay.
You're free to choose any doctor who accepts Medicare anywhere in the country.
That's pretty great.
Yeah, it is. And as long as you pay your premiums, your benefits are guaranteed renewable for life.
Peace of mind right there. Are there any downsides to Medigap?
Well, while the benefits are guaranteed, the premiums can go up each year.
Okay.
And if you're looking at those high deductible plans like Plan F and Plan G, those deductibles are subject to inflation adjustments.
Right.
So Medigap offers great coverage, but those rising premiums are something to consider.
Okay, good to know. So Medigap works with traditional Medicare. What about Medicare Advantage? How does that fit in?
Medicare Advantage, also known as Part C, it's essentially an alternative to traditional Medicare.
Okay.
So instead of getting coverage directly from the government, you enroll in a plan offered by a private insurance company.
Okay.
They bundle your Part A and Part B coverage and often include Part D prescription drug coverage, too.
So it's kind of like a one-stop shop for your Medicare.
That's a good way to put it.
What are the main differences between Medicare Advantage and traditional Medicare with a Medigap plan?
One key difference is that Medicare Advantage plans, they're yearly contracts. So the plan's benefits, the costs, the network of doctors, all that can change from one year to the next.
Oh, so you really have to pay attention every year and see what's going on with your plan.
You do, yeah. You need to review your plan every year during open enrollment and make sure it still works for you.
So it's maybe a little more hands-on than the traditional Medicare with Medigap.
Can be, yeah. You really need to stay on top of any changes to your Medicare Advantage plan.
Okay. Speaking of changes, remember those new Part D guidelines? Like that $2,000 out-of-pocket limit?
Right.
Even though Advantage plans are private insurance, if they include drug coverage, they still have to follow those guidelines.
They do. They have to follow those same Medicare rules.
Okay.
Yeah.
What about the costs? Are the costs for these Advantage plans generally comparable to traditional Medicare?
Not always. We're seeing a trend where a lot of Advantage plans that used to have really low or even no drug deductibles are now raising them.
Okay.
And another thing to watch out for. The maximum out-of-pocket limit for Advantage plans is increasing to $9,350 for in-network services in 2025.
$9,350. That's
Yeah, it's a lot.
it's a big chunk of change.
It is.
So choosing between traditional Medicare and Medicare Advantage is a pretty big decision.
It definitely is. And switching between the two isn't always easy.
So you can't just switch back and forth during open enrollment.
It's not quite that simple. Switching from a Medigap plan to an Advantage plan, usually that's not a problem.
Okay.
But if you want to go back to traditional Medicare with a Medigap plan after being on an Advantage plan, it's not always that easy.
Okay.
The rules really depend on where you live and your health status.
So you're saying once you're on Medicare Advantage, it might be harder to switch back to traditional Medicare.
It can be, yeah. It's not impossible, but it's not as easy as just switching during open enrollment.
Right.
There are some exceptions, though. Like there's a trial right that lets you try an Advantage plan and then go back to a Medigap plan within 12 months if you're not happy with it.
Okay.
But again, the specifics can vary, so it's essential to do your research.
So all this sounds pretty overwhelming. Is there any help out there for people who are feeling lost in this Medicare maze?
Absolutely. This is where working with an independent broker can be a game changer.
Okay.
They can help you understand all the ins and outs of Medicare and give you unbiased advice that's tailored to your specific situation.
So instead of trying to figure it all out on your own, you can have someone kind of walk you through it.
Exactly. They can explain all the different parts of Medicare, help you compare plans, and find the best fit for your needs.
That sounds like a huge relief.
Yeah.
How do you even find a good independent broker? And do you have to pay for their services?
Well, finding a reputable broker is easier than you might think.
Okay.
You can start by asking friends or family who are on Medicare if they have any recommendations. Or you can search online for brokers in your area and check their reviews.
Okay.
And the best part is their services are typically free. They get paid by the insurance companies when they enroll someone in a plan.
Oh, okay. So it's not like they're adding an extra fee on top of the plan's costs. Their compensation is already kind of factored in.
Exactly. You don't have to worry about any extra fees for working with a broker.
That's great. It's like having a personal shopper for your Medicare coverage.
I like that analogy.
But the stores are paying them, not you.
Precisely. And like a good personal shopper, a good independent broker will listen to your needs and preferences to help guide you towards the best options.
Fantastic. Okay, so we've covered a lot of ground in this first part of our Medicare deep dive.
We have.
We've tackled premiums and deductibles and all the different parts of Medicare, including those tricky choices between traditional Medicare and Medicare Advantage. But our journey isn't over yet.
Not at all.
We'll be back with part 2, where we'll dig even deeper into some strategic considerations and helpful resources to empower you to make the best choices for your Medicare coverage.
Stay tuned. There's a lot more to discover.
Welcome back to our deep dive into Medicare changes for 2025.
We're back.
I don't know about you, but
Yeah.
my head was spinning a little bit after that last part.
It's a lot to take in.
It is a lot.
But don't worry.
Right.
We're here to break it all down.
Exactly.
Yeah.
So last part, we talked about all those different parts of Medicare, the premiums, the deductibles, all that.
All the fun stuff.
Now let's get strategic.
Yeah.
Like, where should people even begin when they're trying to make sense of all these options?
Yeah, where do you even start?
Yeah.
Well, I think the most important thing is there's no one-size-fits-all answer when it comes to Medicare.
Okay.
The best choice for you is going to depend on a lot of things. Your health, your budget, your lifestyle, even your risk tolerance.
So it's really personalized.
It is. It's like, building a custom suit. You need to find the perfect fit for you.
Okay, custom suit. I like that. What are some of the things that people should be thinking about when they're trying to make those decisions?
Well, first and foremost, consider your health.
Okay.
Are you generally pretty healthy, just need routine checkups, maybe a few prescriptions?
Yeah.
Or do you have any chronic conditions that require more specialized care or expensive medications?
Right.
Your health needs are going to be a big factor in what kind of coverage you need.
That makes sense. If you're on a lot of medications, that Part D stuff becomes even more important. What else?
Your budget is another big one. Take a realistic look at your income and expenses and figure out how much you can comfortably afford to spend on healthcare each month.
Right, because all those premiums and deductibles and coinsurance, they add up.
They do, especially with those premium increases.
Yeah. So health, budget, what else?
Think about your lifestyle and how you prefer to get your healthcare. Do you like having a wide range of doctors to choose from? Or are you okay with a smaller network? Do you travel a lot and need coverage that goes beyond your home state?
Right.
Or are you more of a homebody? These are all things that can help you decide between traditional Medicare with a Medigap plan or a Medicare Advantage plan.
Like I'm thinking about those snowbirds, those folks who fly south for the winter.
Exactly.
Their Medicare needs might be very different from somebody who stays put all year.
Totally different.
Okay, so lifestyle, travel.
And one more thing, your risk tolerance.
Okay.
Are you someone who prefers to know exactly what your healthcare costs are going to be, even if it means paying a little more upfront?
Yeah.
Or are you comfortable with a little more uncertainty? Maybe you pay lower premiums, but, you could have higher out-of-pocket costs if something unexpected happens.
That's a really good point. Some people really value that peace of mind, knowing they've got that safety net.
Right.
And other people are, willing to take a little bit more of a gamble. Okay, so lots to think about.
Yeah.
Any tips on how to make this process a little less daunting?
Definitely. Break it down into smaller steps.
Okay.
Don't try to do everything at once. Just start by understanding the basics.
Okay.
What are the different parts of Medicare? How do they work?
Right.
Then think about your own needs and preferences. Your health, your finances, your lifestyle, your comfort level with risk.
Divide and conquer.
Exactly.
Make it less scary.
And once you have a good picture of your own situation,
Yeah.
you can start looking into the specific plan options that are available to you.
Okay.
Whether that's traditional Medicare with a Medigap plan or a Medicare Advantage plan.
Right. And remember, Medicare.gov, that website's a great resource
It is.
for all of this stuff.
Yeah.
What about when you're actually looking at the plan details? Any tips there?
Read the fine print.
Ugh, the fine print.
I know. Nobody loves it.
Yeah, it can be so tedious.
But it's really important when it comes to Medicare. Don't just skim the plan summaries. Look at the full plan documents.
Okay, what should people be looking for specifically in those documents?
Look for the details of the coverage,
Yeah.
including any limitations or exclusions. For example, pay really close attention to the plan's formulary.
Right, that list of medications they cover.
Exactly. Make sure your medications are on there and understand how their tier system works. That determines how much you'll pay for different drugs.
Right, so a plan might look great at first glance, but then those little details in the fine print can really change things.
They can.
What if you're feeling lost in all that fine print?
Don't be afraid to ask for help.
Okay.
If you're confused about something, reach out to the insurance company, or even better, talk to an independent broker.
Right.
They can help you understand all that jargon and make sure you really know what you're getting into.
Okay. Speaking of independent brokers, we talked earlier about how their services are usually free. But how does that work? If they're not charging us, how are they making money?
Right, that's a good question. Independent brokers, they typically get paid by the insurance companies.
Okay.
When they enroll someone in a plan, they get a commission,
Okay.
and that commission is built into the cost of the plan.
So it's not like they're adding an extra fee. It's already factored in.
Exactly. That's why it doesn't cost you anything extra to work with a broker.
Okay.
In fact, it could even save you money because they can help you find the most cost-effective plan that meets your needs.
It really is like having that personal shopper for your Medicare, but the stores are footing the bill.
That's a great way to think about it.
How do we find one of those good brokers?
That's the key, right? How do you find a trustworthy broker who really has your best interests at heart?
Right.
Well, word of mouth is always a good place to start. Ask your friends, family members, colleagues if they have any recommendations. You can also search online for brokers in your area and look at their reviews and ratings. Look for brokers who have a solid track record, who are properly licensed and certified, and who offer a wide range of plan options from multiple insurance companies. And really importantly, look for a broker who's committed to educating you,
Right.
making sure you understand your options.
Not just trying to sell you something.
Exactly. They should be empowering you to make the best choice for yourself.
Okay, so it's really about finding somebody who's like a teacher.
Yeah, more of a teacher than a salesperson.
They're patient, they're knowledgeable, and they're really invested in helping you find the right coverage. And remember, you don't have to enroll in a plan just because you talk to a broker.
That's right.
You're in control.
Absolutely. You're the one making the final decision.
So we've covered a lot in part 2. We've talked about how to assess your needs, those plan details, the value of an independent broker. As we head into the final part of our deep dive, what are some key takeaways you want folks to remember?
I think one of the biggest things is that Medicare isn't one size fits all.
Mm-hmm.
There are so many options out there, and the right choice for you might be very different from the right choice for your neighbor.
Right.
So don't get overwhelmed. Take it one step at a time, assess your needs, do your research, and don't hesitate to ask for help.
Great advice. It's easy to get bogged down in the details, but you're not alone in this.
Yep.
There are resources available, and with a little bit of effort, you can make those informed decisions that give you control over your healthcare.
Exactly. And Medicare is always changing.
Yeah.
So stay informed. Review your options every year during open enrollment.
Good point.
Make sure you're still in the plan that makes the most sense for you.
Like a yearly check-in.
Exactly. You got it.
All right, we're ready for the final part of our deep dive.
Let's do it.
All right, welcome back for the final part of our Medicare deep dive.
It's the home stretch.
We've covered so much, all the different parts of Medicare,
Yeah.
what they cover, what they don't,
Right.
those premiums, deductibles, all those fun things, and of course that big decision. Yeah. Traditional Medicare versus Medicare Advantage.
Yeah, big one.
It's been a workout for our brains,
It has.
but we've got some final tips and insights
Yeah, absolutely.
to help you put all this knowledge to work.
We want you to feel empowered
Yes,
to make those decisions about your Medicare.
exactly. So, what's the number one thing you should keep in mind?
Start early.
Okay.
I can't stress that enough. Don't wait to the last minute,
Yeah.
a few months before you turn 65.
Yeah,
Start thinking about Medicare now. The sooner you start, the better.
like anything in life.
Feel right? Absolutely.
More prepared you are,
Yeah.
the less stressful it is.
Yeah.
So start early, do your research. What else?
Don't be afraid to ask for help.
Okay.
There's so many resources out there, and there's no shame in getting some guidance.
Right.
Medicare can be confusing.
It can be.
You don't have to do it all by yourself.
Yeah, it's a big system.
Medicare.gov is a great starting point.
Mm-hmm.
And of course, talking to a broker can make a huge difference.
Yeah, we talked about that.
And, talk to your friends and family, too.
Yes.
People who've gone through this.
Right, get their advice.
They can be a great help.
Okay, so ask for help, use your resources. Any other tips?
Stay organized. Keep all your Medicare stuff in one place.
Okay.
Your Medicare card, your plan information, all those documents.
Oh, like a designated Medicare folder?
Exactly.
Smart.
Saves you so much trouble later.
Right. Because, I can picture myself now like just frantically searching for that one piece of paper.
Oh, yeah, we've all been there.
So important to stay organized.
And review your coverage every year.
Okay.
Even if you're happy with your plan,
Yeah.
don't just assume it's still the best option.
Right. Things change.
They do. Things change. The plans change. Your needs might change.
Exactly.
So during open enrollment, take a look at your options. Make sure you're still in the right plan.
It's like a yearly check-in.
Exactly, like a checkup for your Medicare.
Okay, so check in regularly, stay organized, ask for help. Any final words of wisdom?
Remember, Medicare is there to support you.
Yeah.
And while it can seem complicated, you've got this.
You do.
With the right information, a little effort,
Mm-hmm.
you can make the decisions that give you control over your health care.
Okay.
And that's what it's all about.
Awesome. Well, that wraps up our deep dive into Medicare for 2025.
We made it.
We did. We covered a lot. But remember, knowledge is power. And with a little effort, you can make those informed decisions.
That's right.
Thanks for joining us.
And thanks for having me.
Until next time.
Take care.